Good morning. To this early morning session, I am going to talk about association of methylene tetrahydrofolate reductase gene C677T polymorphism in patients of cataract. As we know, MTHFR is the main regulatory gene for folate and homocysteine metabolism. It is the main methyl donor during homocysteine metabolism, and its deficiency causes homocystinemia. There are 34 rare and 9 common variants known to us. C677T variant is the most common cause for hyperhomocystinemia. This occurs due to point mutation, which leads to substitution of cysteine to thymine at 677 position, and later on substitution to alanine to valine at this position. And this makes the gene less thermostable. This is a homocysteine metabolism. We can see the MTHFR. You have the pointer? Pointer. Okay, as you can see, the MTHFR, folic acid, vitamin B12, and vitamin B6 are the main factors. Hyperhomocystinemia can be due to deficiency of vitamin cofactors or due to functional polymorphism of the gene. Homocystinemia is associated with endothelial cell injury, and it is also said as a stressor for lens epithelial tissue, which is associated with cataract formation. We can see hyperhomocystinemia causes oxidative stress, which leads to lens opacification and visual dysfunction. MTHFR polymorphism is also associated with primary open angle glaucoma, arteriovenous occlusion, ARMD, and retinal emboli. Tan et al. In their study said that about 33% of the risk for incident cortical cataract from MTHFR polymorphism is due to indirect pathway, that is due to homocysteine elevation, and while 2/3 is due to the direct pathway of the polymorphism. Similar study was carried out by Wang XB in China, and the study indicated that the variant of MTHFR gene might individually or jointly influence susceptibility to age-related cataract. On the basis of this, we investigated MTHFR gene polymorphism C677T in the patients of age-related cataract in a case control study. It was conducted at Swami Dayanand Hospital in collaboration with Institute of Human Behavior and Allied Sciences, Delhi. 40 cases of cataract and 40 healthy individuals without cataract were enrolled, and they were subjected to estimation of MTHFR gene polymorphism, serum homocysteine levels, vitamin B12, and folic acid. Exclusion criteria: any patient with complicated cataract or traumatic cataract, diabetes mellitus, coronary artery disease, malignancy, or multivitamin supplements were excluded. 10 ml of the sample were taken, and the MTHF our gene polymorphism, serum homocysteine level, and vitamin B12 and folate level was studied. DNA extraction was done using commercial kits available by restriction fragment length polymorphism method. Serum homocysteine assessment was done using Dilab homocysteine enzymatic cycling reagent kit, while serum vitamin B12 and folate assessment was done by commercially available kit using chemiluminescent analyzer. So we found that MTHFR C677T gene polymorphism in cataract cases was significantly higher than that in control cases. This is the PCR showing, we can see the CT showing polymorphism. There are two bands showing, this is the polymorphism gene. In the bar diagram, we can see the polymorphism was seen in 45% of the cataract cases, while only general population has 22.5% polymorphism. So the serum homocysteine level, folic acid, and vitamin B12 level, although it was found to be higher in the patients of without cataract, but it was not significant. We conclude that if future research is carried out in larger sample and broader ethnicity group, then MTHFR gene polymorphism may represent a new biomarker. Since our study showed, just a minute. In our study, the MTHFR gene polymorphism was significantly higher in the patients of cataract than compared to the patients without cataract. So the present study broadens our understanding about genetic markers of age-related cataract and also emphasizes the need of investigation of association of MTHFR C6717 T gene polymorphism in large cohort of Indian population. Thank you.
Any questions? Okay, ma'am, I just wanted to have a few questions.
Yes, sir.
Firstly, did you find any difference in the type of cataract in these patients who had this polymorphism present?
Sir,
in the sense, in the morphological
sir, we did
structure?
not do any statistical analysis. We took all the age-related cataracts. But we can further, we are planning to do further like cortical cataract, nuclear cataract, we can segregate.
Okay, the second thing is, since it is known that hyperhomocystinuria can also cause vascular problems like CRVO, all those problems,
Okay.
did you study the association of the individuals who had this polymorphism in addition to cataract? Did they have any other lesions?
No, we did not.
You
We did not consider that.
So otherwise, actually, it's a nice study, but the problem is there are so many confounding factors in age-related cataract that it's very difficult to sort of
Yes, sir.
pin it down
In
to...
our study, in fact, we did not find hyperhomocystinemia. So we are taking it as it was mainly due to the direct pathway, which was due to the polymorphism, gene
but the
polymorphism.
homocysteine levels were normal in these
Yes,
patients.
it was raised in few patients, but it was not statistically significant. So it was directly leading to the polymorphism was leading to age-related cataract.
So thank you, ma'am. So a good first step, I think it can lead to further studies.
Okay.
What was the age criteria?
Ma'am,
Ma'am, what was the age criteria?
50.
50. Okay,
All the patients' case and control were 50 years age.
thank you.